5. Deadly diabetic foot ulcer signs. Imagine walking on a minefield where each step could trigger a health disaster. That's the reality for those with diabetes, where a mere foot sore could lead to irreversible damage or worse. While diabetic foot ulcers might seem like a minor inconvenience, they're silent alarms for potentially life-threatening conditions. With a 50% mortality rate within 5 years of diagnosis, understanding these signs is critical. In today's deep dive, we'll guide you through the 5 critical signs of diabetic foot ulcers, unveiling the hidden dangers lurking beneath each symptom. We'll not only reveal these risks, but also arm you with prevention and treatment strategies. Before we venture into this critical video, can I ask you a favor? If you're new here, please click the like and subscribe button to support our fight against diabetes. And don't forget to click the bell icon so you won't miss our new videos. Stay tuned till the end because we've curated 3 invaluable gifts that will empower you not just to manage, but possibly prevent diabetes. Let's get started. Number 5. Swelling and redness around the wound. Swelling and redness around a diabetic foot ulcer are crucial indicators of potential infection and tissue damage, which diabetic patients' poor blood circulation and impaired healing processes can make worse. Research published in the Journal of Diabetes and its Complications indicates that more than 80% of diabetic foot ulcers exhibit visible swelling and redness, underscoring the importance of closely monitoring these symptoms. Timely intervention is crucial in addressing swelling to prevent further complications like extensive tissue damage and an increased susceptibility to serious infections. Observing changes in the color and temperature of the affected area can aid in early issue detection, facilitating prompt interventions that enhance treatment outcomes. Persistent swelling or redness around the ulcer site necessitates immediate medical attention to mitigate the risk of severe complications. Effective management of diabetic foot ulcers requires vigilant monitoring and proactive measures to avert potential health hazards associated with this condition. Individuals with diabetes should adhere to a comprehensive foot care routine to reduce the likelihood of developing ulcers and related complications. Regular consultations with healthcare professionals play a vital role in effectively managing diabetes-related foot problems, ensuring timely interventions and holistic care for optimal health outcomes. As we peel back the layers, a more sinister sign emerges, one that signals deep-set damage and a fight for recovery. Number 4. Black tissue surrounding the ulcer. The presence of black tissue, commonly known as eschar, encircling a diabetic foot ulcer, serves as a critical indicator of extensive tissue damage and potential infection. According to the American Diabetes Association, the presence of black tissue around a diabetic foot ulcer typically indicates tissue necrosis due to decreased blood flow and hampered healing processes in diabetics. This occurrence indicates that the ulcer has advanced to a serious stage with impaired blood flow and significant tissue necrosis. When presented with this concerning symptom, it is vital to promptly seek medical intervention to prevent further complications and avert the need for more aggressive treatments. Delaying treatment in such cases could expose the affected individual to substantial health hazards. For those dealing with diabetic foot ulcers, made more difficult by the presence of black tissue, regular monitoring and strict adherence to prescribed treatment regimens are essential to ensuring favorable outcomes. Black tissue around an ulcer signals a dire warning, but there's another symptom that's not just a matter of sight but smell. How can something invisible to the eye be a glaring alert to immediate danger? Up next, we dive into a symptom that brings a whole new dimension to identifying diabetic foot ulcers. Number 3. Foul-smelling discharge from the ulcer. Foul-smelling discharge from a diabetic foot ulcer is a significant symptom that people living with diabetes should be attentive to, as it can indicate the presence of an infection, which poses a considerable threat. Once a foot ulcer becomes infected, bacteria may multiply, leading to the release of malodorous discharge from the wound. Signs like redness, swelling, and increased pain may be present along with this discharge, which typically has a strong odor. Infections in diabetic foot ulcers have the potential to progress rapidly, resulting in more severe complications if not promptly addressed. Timely medical attention is crucial in managing the infection, preventing further damage, and improving the chances of successful wound healing. Ignoring foul-smelling discharge from a diabetic foot ulcer is unwise, as it serves as a warning sign that demands immediate assessment and treatment. By promptly addressing these symptoms, you can minimize the risks associated with diabetic foot ulcers and focus on achieving optimal recovery and healing results. Additionally, maintaining proper foot hygiene, inspecting feet regularly for any signs of injury or infection, controlling blood sugar levels effectively, and wearing appropriate footwear at the earliest indication of problems are vital steps in preventing diabetic foot ulcers and related complications. Yet, even as we confront this invisible enemy, subtler signs lie in wait, ready to unveil the full scope of diabetes' silent assault on the body. While these signs are alarming, the true enemy lies in what we cannot see. The battle against diabetic foot ulcers is not just on the surface, it's a fight against an invisible force that threatens every step. The presence of a foul-smelling discharge might be easy to detect, but our next sign is far more insidious, hiding in plain sight. What subtle changes might you be overlooking that could spell trouble for your foot health? Coming up next, we uncover a symptom that might just be the missing piece in your vigilance puzzle. Number 2, changes in skin color and temperature. Skin that appears pale, red, or bluish, coupled with noticeable temperature fluctuations in the affected area, may suggest underlying issues such as poor blood circulation and nerve damage. These alterations in skin characteristics are particularly concerning when they occur in specific areas, highlighting the need for prompt medical attention to prevent potential complications. According to research by the American Diabetes Association, changes in skin tone and temperature can serve as early warning signs of diabetic foot ulcers. It has been observed that nearly 85% of diabetic foot ulcers are preceded by these changes, making them crucial warning signs to watch out for. Regular monitoring of any shifts in skin color and temperature can aid in the timely detection of diabetic foot ulcers, enabling healthcare professionals to intervene early and mitigate further harm. If you notice any of these symptoms, it is essential to consult a medical expert promptly for appropriate guidance and treatment. Early intervention plays a vital role in managing diabetic foot ulcers effectively and reducing the risk of serious consequences. We're on the cusp of revealing the most critical diabetic foot ulcer sign. But first, let's take a moment to highlight the life-changing resources we've compiled for you. First up, we're giving away our exclusive ebook, 13 Foods That Lower Blood Sugar. This is no ordinary list. It's a treasure trove of culinary delights that are both mouth-watering and beneficial for maintaining stable blood sugar levels. Then, for those of you who relish in the joy of cooking, we're excited to present a special recipe book. This collection is packed with ingenious, low-carb alternatives to staple foods like rice, pasta, and bread. These recipes promise to delight your palate while being friendly to your diabetic health needs. And lastly, you'll gain access to our breakthrough video, 30-second bedtime solution to stop diabetes. This innovative approach, the result of 20 years of dedicated research, offers a potential paradigm shift in how you manage diabetes. It's a piece of knowledge too valuable to miss. To claim these incredible free gifts, simply click on the link in the description below. Now, let's return to our countdown and unveil the number 1 symptom that stands as a pillar in the deadly diabetic foot ulcer signs. Number 1. Pain and sensitivity. Around the ulcer area, foot ulcers, particularly in diabetics, are prone to infection due to the compromised blood flow and nerve damage common in diabetes. Pain and sensitivity could signify an infection setting that can quickly become serious, leading to conditions like cellulitis or, in worse cases, sepsis, both of which can be life-threatening if not treated promptly. Persistent pain in the affected area should never be disregarded, as it could indicate serious issues like chronic wounds or nerve damage. Wearing diabetic-specific footwear can alleviate pressure and reduce the risk of ulcers developing into painful complications. Regularly inspecting your feet for any changes in sensitivity or appearance can catch problems before they escalate. According to a study published in the Journal of Diabetic Foot Complications, early intervention in diabetic foot ulcer management resulted in a 60% reduction in the risk of severe complications. In severe cases, advanced treatments such as debridement, offloading techniques, or even surgery may be required. Early intervention and comprehensive care play a pivotal role in fostering healing and diminishing the risk of amputation in diabetic patients with foot ulcers. Regular consultations with healthcare professionals specializing in diabetic foot care are also essential to ensure appropriate management of the condition. We've navigated through the 5 critical signs of diabetic foot ulcers together, shedding light on a path often shadowed by uncertainty. Remember, awareness and early action are your best defenses against these silent threats. Monitoring for signs, embracing timely care, and maintaining diligent foot hygiene aren't just steps. They're leaps towards safeguarding your health against diabetes' more sinister repercussions. Now, it's your turn to join the dialogue. Which of these signs was a revelation to you? How will you integrate today's insights into your daily vigilance? Drop your answers in the comments. We love hearing from you and learning about your experiences and preferences. Don't forget to claim your free gifts. Click the link in the description for access to invaluable resources that will further empower your journey with diabetes. If you found value in our time together today, please show your support by hitting the like button, subscribing to our channel, and clicking the bell icon. For those who wish to go a step further, consider showing your appreciation through the Super Thanks feature. Your support fuels our mission to deliver impactful health content. Remember, your health is in your hands. Thank you for watching, and here's to a healthier, happier you.